Mr. Speaker, I rise today to highlight National Rural Health Month and to honor the men and women who keep healthcare alive in America's small towns and rural communities. As co-chair of the Congressional Bipartisan Rural Health Caucus, I'm proud to join my colleagues in leading an effort to ensure the millions of Americans who live in rural areas, including the hardworking people of Tennessee's 1st District, receive the same quality of care as anyone else in the nation. In Northeast Tennessee, that rural health care is it's a lifeline to people, especially who live in remote areas and are limited or have no mode of transportation, and they depend on a nurse, say, to drive during the night and before dawn to check on a patient, or the pharmacist who knows every family by name and stretches every dollar to keep medicine affordable. It's the doctor who stays late to see one more patient because there's no one else to take the next shift. These are the people who form the backbone of our rural health care communities, and they deserve a system that works as hard for them as they do for us. But the truth is, rural health care has always faced an uphill battle. When a rural hospital shuts down, it doesn't just take away health care, it takes away jobs and stability and peace of mind. And it means longer drives for emergency care, fewer options for expectant mothers, and limited access for seniors and veterans who depend on those services the most. And the systems that's supposed to support them is too often buried in bureaucracy. Pharmacy benefit managers are manipulating drug prices, restricting choices, and squeezing out small-town pharmacies that are fighting just to survive. These PBMs see a patient, but they control what medicines people can get and at what cost. That's wrong. And I've been proud to lead bipartisan legislation to bring transparency, accountability, and fairness to that system, because patients and pharmacists alike deserve better. I've made it my mission to champion these policies that put people, not politics, first. And under President Trump's leadership, we signed the Working Families Tax Cuts into law this year. And this critical legislation included the single largest investment in rural health care in history. That's $50 billion for a rural health care transformation fund to reinvest federal savings directly into the communities that need it most, expanding telehealth and recruiting and retaining rural health care workers. We're committed to ensuring telehealth remains an option for those living in rural communities. Telehealth provides expanded access to specialists, closes the distance between patients and providers, and gives families faster, more reliable care. And I have legislation, the Rural Physician Workforce Production Act, that would help bring more doctors to rural communities by giving rural hospitals the resources they need to train and retrain more physicians. I fought to strengthen our nation's drug supply chain by supporting domestic pharmaceutical manufacturing, including facilities like U.S. Antibiotics in Bristol, Tennessee, where we're proving that these life-saving antibiotics can and should be made right here in the United States and not halfway around the world. Mr. Speaker, these aren't abstract policy debates. They're about real people in real places. They're about the mom who drives an hour to find a pediatric specialist. They're about the veteran who can't get his prescription filled because his local pharmacy closed. They're about the nurse who works back-to-back shifts because there aren't enough hands to go around. And those stories are what drive my work every single day. And that's why I've joined my co-chair, Representative Takuda, in introducing a resolution to recognize November 20th, 2025 as National Rural Health Day. This resolution recognizes the challenges we face, but more importantly, it affirms our commitment to solving them. Thank you, Representative Takuda, for your continued commitment on working together to address the pressing health care issues facing our rural communities. We must fight for a health care system that serves patients, not big insurance companies, that values rural providers, not red tape, and ensures no community, no matter how small or remote, is left behind. To our doctors and our nurses, pharmacists, first responders who keep rural America healthy, we want to thank you. Your work saves lives, your compassion gives hope, and your dedication holds our communities together. As long as I have the privilege to serve the people of Tennessee's 1st District, and as co-chair of the Rural Health Caucus, I will continue that fight. And we are united in our shared mission to strengthen rural health care, protect patient access, and preserve the small-town values that make this nation strong. And with that, Mr. Speaker, I yield back.
Thank you. Mr. Speaker, National Rural Health Day is a chance to honor the